Hello, it's Rikki Fanning here. So we're doing video number 37, oral anatomy and charting. So this is Ziggy, who is a feline that's in today for a dental. So we're going to have a look at the oral cavity, including the pocket depth and the dental pathology as well. So coming over to the teeth, we've got the maxillary, which is up the top drawer. We're going to start with the 103, which is the incisor. So the little one here is the incisor 3, and to check that pocket depth, so that is 0.5, going around the whole circumference of the tooth, checking for things like mobility. There's no mobility in that one. There's no recession or anything, so you can't see the bone coming through above the line of the gingiva, and there's no gingivitis, so that one's really good. Then we've got the canine here, which is 104. This does have a little bit of gingivitis, so probably a grade 2, and going around the whole circumference of the tooth, making sure that is the same depth, which is, so I'm probably getting about a 1 going around there. Then we've got, you can see signs of recession here. So there is, that's just starting. I would probably say grade 2. And again, there's no mobility at all. Then we're going to go to the mandible, which is the lower jaw here. So the premolars, which are here. So this is premolar 1, which is number 407. Again, going around with the periodontal probe, checking the whole circumference of the teeth. And I would say that is about a 0.5 millimeters. And you can see there's a small amount of gingivitis because it is bleeding a little bit. So I would probably say that's a grade 2 because it's showing a little bit of bleeding when you're probing it. And you can see there's no recession like there is on the canine. The tooth looks quite healthy, and again, there's no mobility in that tooth. The last one is the molar that we're going to have a look at, which is back here. So this is number 409, and you can see there's quite a lot of gingivitis there, and some staining. So again, going around that tooth and measuring that, probably depth of 0.5, and then recession, you want to change the probe, and then go along and probe that, and that's checking for furcation. And there you can see there's also recession around that tooth. The gum line's gone quite down a little bit. I'd probably say that's about 3 millimeters along there. And again, checking for mobility. So there's no mobility in that tooth. That looks quite good as far as that goes. Hello, it's Rikki Fanning here. So the cat in this video is Ziggy. He is 6 years and 5 months old, 5.4 kilos. I've just got his dental form, anaesthetic form and admit form here. Russian blue, male, neutered, and he is having a grade 1 dental today. Okay, so we have his dental chart here. So we'll just go through this. So basically we've got his details up here, going through talking about his pre-treatment pathology, current home dental care. So I've just got down at the bottom here, current home dental care is none. He actually only eats wet food. So we are going to recommend that the owner tries to give greenies as treats, which we sell in our clinic, as well as introducing Hill's TD dental diet to his daily food requirements. We've got our dental key here, so that goes through all the different, I'll just zoom in a little bit so you can see, and we've got the pre-dental here. So this was charting during the anesthetic of this animal. So basically going through each area and just charting the pocketing depth. We've got all of the teeth here, making sure that they're all there, and checking for things like gingivitis, recession, furcation, mobility, periodontal disease, and pocketing depth of every single tooth on there. You'll note in the video I am wearing PPE throughout, so it is really important to wear PPE, especially when you're doing a dental. There is like 300 different types of bacteria that are in cats and dogs' teeth or mouth, and also microorganisms that also can become airborne as well. And they're usually in the vicinity of the patient or in and around the dental room, especially when we're scaling and polishing. It is really important to wear eye protection, making sure that the operator and assistant, we're making sure that they prevent injuries as well to the eyes, because you can get things like flying debris from the teeth, or a fractured high-speed burr, for instance, which travel at enormous speeds. So they can be quite dangerous and really can cause a serious damage. So it's really important that we protect ourselves. As well as that, they are really good at preventing like general splatter and aerolized material from getting into the eyes. Making sure that we wear head coverings and gloves. These are worn I guess for protection of gross contamination, microorganisms, and scrubs. We also make sure we wear scrubs in our dental unit as protective clothing. That's as per clinic protocol. You can wear gowns on top if you don't have scrubs, but in this case I was wearing my scrubs. The encoding system that was used, the one that we use is obviously a clinic one that we've designed for our clinic specifically. That's what most clinics do, but it was very similar to the dental label one that I saw in the notes. So basically using a modified Trident system. So it is a 3-digit numbering system, so you can see here that there's 3 digits on each tooth. So that basically the numbering system, the first digit, so you'll see these ones are number 1, and there's 2 on that side, 4 on this side, and 3 down there. So the first digit is the quadrant of each mouth. So you'll see it's divided into 4 quadrants. And then whether or not they are permanent dentition as well. And then the second and third numbers, they indicate the tooth specifically. So we've got our incisors here, our canines, our premolars and our molars. You can see a pre-treatment up here and a post-treatment. Because it was only a grade 1 dental, there's not much that you can really write on the post-treatment. This particular animal did have a lump just above 409 here, and that was bleeding a little bit, so that was actually removed. So I have updated that here, so you can see it was removed. So I made sure I used the dental key down here. So if there was any, you would do the extraction one here, and you can see we have used that dental key throughout, pointing out the recession, gingivitis, all that kind of stuff. But yeah, that would normally be transferred over if you did like take any teeth out or anything, then you would be crossing these ones, and these ones only get one line through it, and once it's taken out you cross through it, and that's on your post-treatment. I also have the Ziggy's patient record as well, so making sure that these notes are all made on the patient file, so you can have a read of that. So the vet has built that up as a dental, and basically just goes through exactly what was found in the dental. So basically we scaled and polished all remaining teeth. We also found, so the right lower gingiva adjacent to 409, there was a pinpoint fleshy area. It does bleed when touched. We weren't able to FNA it, but we were assuming it could be possibly trauma or rubbing of the 409. So after discussing with another vet colleague, we decided to remove that lump and close with fluoromonosin. The animal was then planned to come in for a revisit in a week's time, which is generally what we normally do for most of our dentals. We'd like to see them again, make sure everything's going well, see how they're going with their new dental plan as well, making sure they're enjoying the diet, if the owners have any questions or concerns, wanting to know exactly what's going on. And yeah, we sort of go through all of that. So that is recorded in the patient file. We also scan in their dental charts, anesthetic forms, all of that kind of stuff, making sure that everything is covered and the owner is updated with what we have done. Okay, so we're just going to go through the dental pathology that was found on Ziggy's dental. So I'll just go through here. So we've got, let's see, so we're going to start with the 103, which is incisor 3 up here. So you'll see that I've noted that basically we have found 0.5 pocketing depth, no gingivitis, no recession, no mobility. That tooth looked quite good. Then the next one is the 104 up here. That one there. So that is the canine. So that one had a gingivitis scoring of 2. A pocket depth of 1 and recession scoring of 2 and no mobility. Then that was the maxillary jaw. Now we're going down to the mandible, which we're going to go with 407, which is next, which is premolar 1 here. Sorry, just zoom in that one. So premolar 1, so I found 0.5 mils of pocketing. Gingivitis scoring was probably a grade 2. There was no recession and no mobility in that tooth. Then we've got up the top here the 409, which was near the lump that I was talking about. So that one is the molar, and that pocket depth was 0.5. Grade 2 gingivitis with some staining as well on the tooth. A recession of 3 millimeters, and mobility was fine and no furcations at this stage. Then down the bottom here we've given a nerve dental block in the mandible, and that was to remove that lump. So we didn't actually remove any teeth, but we did give a lower right arcade, on the mandible, and we use lignocaine at our clinic. And then I've also made sure that you do need to make sure that you do fill in the extraction times and scaling times. We also do that mainly to help the vets with their billing. So you'll see down the bottom here, I've got some time. So obviously we didn't extract any teeth, and we've got the scaling and polishing times here. So altogether it came to 20 minutes, but I do have on the anesthetic form as well, times are usually recorded along here.